We've been investigating how many people could have been affected by the disruption to the NHS. I'm in Swansea, where the university has been tracking the anonymised health records of the entire population of Wales during the pandemic.
It's one of the most detailed studies that exists anywhere in the world. We know there's been a very large impact on health services, both for the people who were treated and the fact that the health service were then consumed with treating those people and struggled to meet the needs of the rest of the population. We went from 2,500 people a day attending the emergency department to about 1,000. Huge reductions. Around April, which would have been, say, the worst of the months, we went from a situation where our surgery dropped by about 80%.
The research found that during the first lockdown, nearly 62,000 fewer patients were operated on in Wales. That's a drop of 54% compared to the same period last year.
There's been signs that it has been recovering. The bit that we're worried about now as the virus increases, that again will have a massive knock-on effect on the hospitals and their ability to provide those services. The scale of the changes, we've never seen anything like it.
I mean, what is the closest thing we've come to this before?
I think those would have been before I was born,
Yeah.
Effectively, things like world wars.
We've discovered that across Wales during the first lockdown, around 3,500 fewer people were treated for cancer with chemo and radiotherapy. That's a drop of 20% compared to the same time last year. Nearly 33,000 fewer people contacted their GP during lockdown for help with things like anxiety or depression. That's down 50% on the same period last year. More than 700 fewer sought help for severe mental illness, a drop of 43%.